A cancer diagnosis can be very scaring. And when you're diagnosed with a neuroendocrine cancer, what all do you need to know? Hello, I am Dr. Sugandha Dureja. I am a nuclear medicine physician with special interest and experience in neuroendocrine tumors. And today I will be giving you an introduction on navigating a neuroendocrine tumor diagnosis. So, diagnosis of a neuroendocrine tumor can be a difficult situation. Many neuroendocrine tumors are often misdiagnosed for many years as other common conditions like anxiety, asthma, or irritable bowel syndromes because these symptoms are very common and often overlapping. But once a patient is diagnosed with a neuroendocrine tumor, there are a few things to consider, to know, and to understand. Let us start with the navigating the journey. We usually diagnose neuroendocrine tumors on the basis of scans and biopsies. Most neuroendocrine tumors have a special receptor which they express called the somatostatin receptor, which is picked up on a common scan that the patients undergo called the DOTA-NOC or the NOTA-NOC or an octreotide scan. These scans will determine the receptor expression status and the spread of disease in the body. The patients also undergo a biopsy. Now, once the patient has a biopsy, there are some important information that the biopsy reveals. The biopsy will tell you the grade of the tumor, which in turn indicates the aggressiveness of the tumor. A grade 1 tumor, which has a Ki67, that is a figure that you will see on the biopsy, of less than or up to 2% is a grade 1 tumor. These are usually slow growing or indolent tumors. A grade 2 tumor is a tumor which has a Ki67 of between 3% to up to 20%. These can be somewhere in between. And a grade 3 tumor can be with a Ki67 of more than 20%. These are usually more aggressive tumors. Grade 3 tumors can be two types. These can be well differentiated grade 3 tumors, which are usually expressing the somatostatin receptor, or poorly differentiated, which are the most aggressive types of neuroendocrine neoplasms, also called the neuroendocrine cancers. The faster growing or the aggressive type of neuroendocrine cancers usually need chemotherapy, and the slower going neuroendocrine cancers, because of the slow growth rate, will not respond well to chemotherapy. These are the tumors which are treated with other forms of treatment, including octreotide injections, also called sandostatin or lanreotide, and with a therapy of nuclear medicine called PRRT or peptide receptor radionuclide therapy. We have many forms of PRRT now using beta emitting lutetium, or now we even have alpha emitting PRRT using actinium, which can be very useful in patients with lower grades of neuroendocrine tumors. Another important thing to know is the functional status of the tumor, which depends on the hormone secretion status of the tumor. Tumors which produce hormones will produce symptoms due to the side effects caused by these hormones. These are called functioning tumors. Other types of tumors which do not produce excess of hormones are non-functioning tumors. These are some important things to know: the grade, the stage, and the functioning status of the tumor when you navigate the diagnosis of a neuroendocrine tumor. A lot of treatment has to be tailored according to all these important aspects of your tumor, the location, the primary site. But for all the most of the well differentiated or the lower grade neuroendocrine tumors, PRRT is one of the mainstays of treatment, and a nuclear medicine physician and your neuroendocrine tumor specialists are the most important team to take care of you. Thank you.